per 100,000 population in Yellowstone County dropped to 32 cases per 100,000 in the week ending December 26th and 34 cases per 100,000 for the week ending January 2nd. This is down from our peak of 106 cases per 100,000 in the week before Thanksgiving. We're about a third of where we were in mid-November. That same week, before Thanksgiving, Governor Steve Bullock instituted a requirement for bars, casinos, and restaurants to close between the hours of 10 p.m. and 4 a.m. In Yellowstone County, I issued a local health officer order that most businesses close during those same hours. I also continued a limitation on group or gathering size of 25 people. I issued that order in November because the disease was spreading so quickly that the number of new cases overwhelmed our public health system. There were so many people seriously ill with COVID-19 that the pandemic strained the capacity of our local hospitals, particularly their intensive care units. At the peak, over 150 COVID-19 inpatients filled our local hospital beds. We were worried that the Thanksgiving holiday would produce another large surge in cases. There wasn't an after Thanksgiving surge in Yellowstone County. Even as the number of COVID-19 cases and deaths rose nationwide, Yellowstone County's case counts decreased in December. 30 Yellowstone County residents died from the disease in December, compared to 31 deaths in November and 33 in October. This week, there were still more than 60 COVID-19 patients hospitalized in Billings Clinic and St. Vincent Healthcare. 1 month ago, 116 COVID-19 patients were in those same two hospitals. I want to thank everyone in Yellowstone County who has been taking the precautions recommended. It hasn't been easy for businesses or individuals to comply, but your cooperation has made a great difference. By keeping our distance, wearing our masks, washing hands frequently, avoiding crowds, working from home, and staying home when ill, Yellowstone County residents have helped reverse the steep case increase we saw in September, October, and November. In mid-November, the first limited supplies of safe, effective COVID-19 vaccines arrived in Yellowstone County. The vaccine is currently being offered to healthcare workers, first responders, and residents of nursing homes and assisted living facilities. As more vaccine arrives in Yellowstone County, it will be offered to the next highest priority group until every Montanan who wants the vaccine has received it. Between Unified Health Command members, Billings Clinic, St. Vincent Healthcare, and Riverstone Health, we have provided the first of 2 vaccination doses to approximately 5,500 healthcare and first responders in Yellowstone County. Nearly all the long-term care and assisted living facilities in Yellowstone County have contracted with CVS or Walgreens to vaccinate their employees and residents, comprising the other large Phase 1A group. We're following Montana's COVID-19 vaccination plan, and we're currently vaccinating only Phase 1A. Earlier this week, Governor Gianforte announced a reprioritization of phases, which opens COVID-19 vaccination to between 250 and 300,000 Montanans in Phase 1B. These Montanans are now in Phase 1B. People aged 16 to 69 years old with certain underlying health conditions, including but not limited to cancer, diabetes, and heart disease. Those individuals over 70 years old, and Native Americans and other persons of color who may be at increased risk of complications from COVID-19. Unfortunately, the COVID-19 vaccine supply has not caught up with demand. So at this time, we are unable to begin vaccinating people in Phase 1B. Montana and Yellowstone County remain in Phase 1A at this time. As vaccine becomes more plentiful, we will broadly communicate all the details that people identified as the next in line to receive vaccine to get their first COVID-19 vaccination. Please stay tuned for these announcements. I encourage Yellowstone County residents to get the vaccine when it becomes available to them. This is a new disease, and it's understandable that people have questions or concerns about the new vaccines. To help us better understand what community members want to know, There we go. Riverstone Health is conducting an online survey. So far, 3/4 of the 3,161 people who completed the survey have said they definitely or probably will get a COVID-19 vaccination as soon as it becomes available to them. I want to point out that the people who answered the survey include a higher proportion of women and older adults than are in the general Yellowstone County population, so we need to be careful about generalizing those findings to the entire population of Yellowstone County. Among those people who said they probably or definitely will not get the vaccine, a majority expressed concerns about the safety, effectiveness, and possible side effects of the vaccine. Clearly, we need to communicate the evidence that the vaccines are safe and effective, with benefits far outweighing the potential side effects. More than 2,000 people answering the survey said they personally know someone who has been hospitalized or died of COVID-19. Each day the pandemic continues, more Yellowstone County residents will know someone whose life has been upended by COVID-19. This survey will remain open until January 15th and is online now at covid.riverstonehealth.org. Let's talk a little bit about testing. Even though we are starting to vaccinate some people, it will probably be many months before we have enough vaccine for everyone. It's important that we continue testing so people who have been exposed to COVID-19 will know whether they are infected and can isolate and take other precautions to care for themselves and to avoid spreading the virus. Riverstone Health is expanding our free testing services. Starting Monday, January 11th, free testing for COVID-19 is available from 8:30 a.m. to 2:30 p.m. weekdays at the Riverstone Health drive-through testing site, which is located at 2173 Overland Avenue. We are now able to make testing available to not only the people with symptoms and close contacts of known COVID-19 cases, but also people who are not close contacts and are without symptoms, but who choose to be tested. This site will test up to 210 people a day and offers both rapid antigen tests with results in about 20 minutes and the PCR test, which requires lab processing that usually takes a few days. A month ago, our hard-working contact tracers had so many COVID-19 cases that a backlog of several hundred cases developed, delaying case investigation and contact tracing. We no longer have a backlog, thanks to the drop in cases and to a new computerized case investigation system Riverstone Health staff have created. The new electronic system allows our contact tracers to work much more efficiently. Our team of 4 COVID education liaisons, working closely with the Yellowstone County Attorney's Office, has been following up on complaints from the public about noncompliance with public health measures. In December, the team received 22 complaints through the State Health Department and 199 complaints through Riverstone Health. In addition to responding to complaints, the liaisons conducted 177 random spot checks of businesses to enhance understanding of public health protocols. Altogether, the small team made 398 visits to Yellowstone County businesses in December. The team also responded to complaints about holiday parties and received assurances from most businesses that they would be mindful of the 25-person gathering limit. And that they would also ensure social distancing and masking. Some large parties did occur despite the team's efforts. The overwhelming majority of bars in Yellowstone County observed the 10 p.m. closing directive from the governor and the Yellowstone County Health Officer order. Bars that flouted the 10 p.m. directive continued to do so despite multiple education efforts. Our liaisons are continuing their work to keep Yellowstone County residents and visitors safe. The pandemic also created a need for a safe place for homeless people to stay when they test positive for COVID-19 or come into contact with a person who has tested positive. An isolation and quarantine site is currently operating downtown adjoining the new Off the Streets shelter for people who lack housing and cannot be served at other local facilities. Since October, 74 people requiring isolation or quarantine have received 417 nights of care. Thanks to the partnership of many local organizations, Off the Streets is successfully keeping individuals safe, simultaneously respecting their privacy and protecting the community from further virus spread. I want to shift my attention now to health officer orders. I issued the latest Yellowstone County health officer order in November when cases were rising rapidly in our county, and extended it in an effort to ensure that cases didn't surge over the holidays. Cases, as we've said, have decreased significantly. Governor Greg Gianforte has announced some of his plans for COVID-19 policy statewide. I've generally followed the previous governor's orders on COVID-19 so that the county and state protocols are generally in sync. Today, I am rescinding all Yellowstone County COVID-19 health officer orders effective immediately. This means that the protocols in our county will depend on the changes and decisions made by Governor Gianforte. The governor noted that current state law allows local orders to be more restrictive than governor's directives. But at this time, I have chosen to rescind all local orders and restrictions out of respect for Governor Gianforte's authority to manage the pandemic according to his policies. Please bear in mind and recognize that the rescission of the local order does not mean that all restrictions are lifted in Yellowstone County. Unless and until Governor Gianforte acts to change or rescind the directives put in place by former Governor Bullock, those directives remain active and compliance with them is required. We are still in phase 2 of the Reopening the Big Sky plan, which imposes a number of restrictions. The statewide masking requirement remains in place. The restrictions on hours of operation and occupancy delineated in the former governor's November 2020 directives are also still active. My action today only rescinds the local health officer orders that I have issued. The statewide directives remain in place unless and until they are modified or rescinded by the governor. The governor has been clear that there might be times that local actions will represent the best response to local case counts, hospitalization rates, and other risks to the well-being of a community. So I certainly cannot say that there will never be another local there will never be local orders in Yellowstone County or elsewhere in the state. For now, though, we will fully embrace and follow the governor's directives without local modifications to them. Please note that businesses, organizations, and schools may choose to keep or add their own precautions that exceed those required by statewide directives. For example, Riverstone Health will continue to require all visitors to mask and to complete a COVID-19 health screening. I thank the members of the media for coming today and for joining us on the phone, and I will now take your questions. Yes?
Governor Gianforte mentioned that he would work to rescind the statewide mask mandate. If that happens, do you intend to issue one for our county?
For the time being, we will follow the governor's directives. Other questions?
Have you had any talks with the governor or his COVID task force?
I've had some conversation with some members of the COVID task force and people at the state health department, but not directly with the governor.
And shifting to the vaccine front, do you have any timetable or educated guess on when Yellowstone County might be able to move into phase 1B with that population?
At this point, we don't. The vaccine supply is not very predictable right now. It changes pretty rapidly from week to week, so we really can't project out how long it's going to take to get through 1A. I sincerely hope that as over the course of the next few weeks, that vaccine supply chain will stabilize and become clarified and allow us to have a better sense of how much vaccine will be coming to our community on a regular basis. Any other questions?
Just asking to clarify, I know you kind of already went over this, but if Gianforte does reverse the mask mandate, you're saying that you're willing to try it in Yellowstone County until if an issue arises?
Yes. My intention at this point is that Governor Gianforte will have a set of policies and that we will follow those policies at this time.
I have a question.
Okay.
Okay. How will a Yellowstone County resident be notified when it's their turn to receive the vaccine once we enter phase 1B?
We will announce when we move to phase 1B, and who is included in that phase. So there'll be public announcements. People will be able to contact their healthcare providers and determine if they're eligible for vaccine. I think we need to understand that if the number, let's just use the number of 250,000 people statewide, our share of that is probably 25 or 30,000 people, and it's going to take a while to get through that. So everyone who, when phase 1B starts, there's still going to be a substantial period of time before we work through that entire phase. But people will have access either through public announcements or through their healthcare providers as to whether they're eligible.
Okay, and so will then it be the responsibility of the residents to make an appointment, or will they be told when it's their chance to make an appointment to get the vaccine?
No, the decision to get vaccinated is a personal decision. We certainly encourage people to get vaccinated, but we will not be telling people you need to come in and get a vaccine at this point, at some particular time. They'll be notified in general of the group that's available for vaccination, and then they'll make their own appointments and decisions.
Okay, so I just meant mostly just because it's such a large number. I didn't know if there was an order to when that window of opportunity was open.
Yeah. So once we're able to move to phase 1B, anyone in phase 1B will be eligible to make an appointment through one of the vaccination sites and go in and get their vaccine. It won't be where we will pick and choose who goes first and last. It'll simply be that the class of group or the group will be available for vaccination.
Thank you.
Yes.
Do you expect to see an increase in cases following New Year's Eve, considering there's a lot of events?
We're a little early to know the answer to that question. We're hopeful that we will not. We did make it through Thanksgiving. As I mentioned, we were very concerned about Thanksgiving, and we made it through Thanksgiving without a surge. At this point, we're just about 2 weeks out from Christmas, and 1 week out from New Year's. So I think if we're going to, the likely time that we'll start seeing a surge is in the next week or 10 days, if it's going to happen. Hopefully, we were as careful as we can be and we won't see that surge, but it's a little early to know at this point.
And for those, you mentioned that some large holiday parties and events still could happen. Is anything being done in retrospect, at least with the liaison, to, I don't know?
So if there are events that we knew about, some of those events were advertised. They were followed up with by the liaison group. We certainly didn't go out on New Year's Eve and break up parties and things like that. But if there are, all complaints are followed up on. So if someone will send us a complaint today about something that happened on New Year's Eve, then that would get followed up on.
And for those bars that keep consistently flouting those rules, I mean, is it just the liaison keep showing up and keep saying, hey, you need to follow this? Or, I mean, is there any kind of work being done to, at least with the county attorney's office or anything, to kind of get them to follow those? Yeah, so
anytime we have multiple validated complaints, those are reported to the county attorney's office. And then it's out of public health's hand and in the hands of county attorneys. Other questions? All right. Thank you all for coming. Please continue to be safe.